Morning, everyone. My name is Jeanette Mallory. I'm with Health Choice. We're a gold sponsor of the conference. I'm going to be your moderator for teledentistry during the pandemic and beyond. Please put your questions in the Q&A section of the chat. And just a little bit of background about this presentation. Teledentistry really took off during the pandemic, and it really hit in March of 2020. As the dental offices changed, it closed, and patients didn't want to go to the emergency room for dental emergencies. The teledentist was able to help patients with emergency situations, toothaches, broken teeth, bleeding gums, and a wide assortment of oral health issues. Our presenter, Howard Reese, is going to talk a little bit about the history of teledentistry and really, who benefits from it and how it's come into play. Howard is the president of Healthy Practices, which is a consulting firm specializing in telehealth. He recently served as CEO of the Teledentist. This is the only nationwide network of dentists providing video consultation for patients with dental emergencies. He continues to serve with them as a board member and advisor. His first exposure to telemedicine was as a project manager at 9X Science and Technology, managing early telemedicine trials with 4 Boston teaching hospitals. Howard has helped 2 separate teleradiology companies achieve Incorporation 5000 status of fastest growing private companies. Howard has an MBA in finance from NYU and has published several articles on teledentistry, teleradiology, telecommunications, and telemedicine. Let's welcome Howard Reese.
Jeanette, thank you so much, and thanks to Health Choice. I really appreciate the invitation, and for those of you in the audience, I'm joining you from New York, about 30 miles north of New York City, but absolutely a pleasure to be with you today. I'll be speaking about teledentistry, but we really can't talk about teledentistry without talking a little bit about telehealth and what has really happened with telehealth, which has been around. And for this talk, let's assume telehealth and telemedicine are one and the same. We can go into some of the subtle differences, but you'll see me go back and forth a little bit. And telemedicine certainly has been around in some form for 50 years, but everything changed, during the pandemic. And, here's a chart that says that the market opportunity for telehealth is a $250 billion market opportunity. Teledentistry has been estimated at about 2.6 billion, so it's just a little bit of, larger than 1% of all of telehealth, but we'll talk about that a bit today. So there are various specialties available in terms of telehealth or telemedicine. And, again, in terms of, my background, radiology really was the first medical specialty where telemedicine was widely used. And, you have telecardiology, very prominent use of telepsychiatry, but dermatology, ophthalmology, pretty much all medical specialties take advantage now of the ability to provide remote access to the specialists, which really is the definition of telehealth. And one wonders many times of, well, how do you do dentistry remotely? We'll talk about that today. But one thing I wanted to talk about in terms of the different types of telemedicine, and the real distinction, or one of the main distinctions, is that a specialty like teleradiology is considered asynchronous. And that's where a medical image like an X-ray or a CAT scan will be sent over the network to a radiologist. The radiologist will do their interpretation, send the result back, maybe in 30 seconds, maybe in 30 minutes, maybe the next day, providing a valuable service, but that's an asynchronous service. On the teledentistry, similar to like the telepsychiatry, it's a synchronous real-time conversation between a patient and a professional, in the dentistry case, with a dentist. So you have both the synchronous versus the asynchronous, and there's some other subtle differences in terms of different types of telemedicine, but that's just one way to look at the difference. So I'm happy to talk to you about the teledentists, which is a virtual dentist available 24 hours a day, 365 days a year, wherever a dentist is needed. And this particular company, the Teledentist, has a national network of dentists. You still following a rule that says the dentist has to be licensed in the state where the patient presents. So it's a network of 300 dentists seeing patients every day. At the point of pain, what the teledentist is doing is providing a differential diagnosis. They're able to prescribe the appropriate medication, and that medication gets sent to a local pharmacy. And it's important to note that the teledentists are not providing any controlled substances. They're, generally providing an antibiotic or recommending another over-the-counter solution. The other service that's provided is if the patient actually does, if it's determined that the patient does need to see a dentist and is either doesn't have a dental relationship, or their dentist has told them, well, we're going to see you in a week or two, the teledentist will try to get the patient a next day appointment with a local dentist. Another important service that's provided is the ability to provide a education service, usually about oral health or taking good care of one's teeth. And also another service is the ability to provide a second opinion. So if a patient has been given a treatment plan or a prognosis that is very extensive or expensive, they may look for the teledentist to be an independent third party. Many cases will confirm what they've been told by the original dentist, but also the opportunity to consider various options. So one question comes up, where can we do teledentistry? And there are well over 260 telemedicine companies in the US right now, and there's very few of them have a dental option, but the teledentist is starting to work with a couple of telemedicine companies looking to be the dental option for a telemedicine service. We're certainly providing that service at home, and if the patient is able to find the teledentist on the web with a very few mouse clicks, you're connected and speaking to a dentist almost always in 10 minutes or less. We're working with one large employer health clinic with Cerner Corporation in St. Louis, and are about to open a second clinic in Kansas City. And just in September, we were connected to our first set of hospital emergency rooms and urgent care centers. And that took place, or is taking place, in Michigan. We're working with mobile health companies. We think there's a tremendous opportunity in providing teledentistry for long-term care. We're working with dental service organizations or urgent care organizations, working through electronic health record companies. We expect to be seeing teledentistry available in retail pharmacies. Very soon after the beginning of the pandemic, the teledentists were able to come to agreements with both Cigna and Anthem. So through their portals, patients are able to get access to teledentistry. We see opportunities with federally qualified health centers and student health centers and travel health, and certainly the opportunity to provide teledentistry on an international basis. So again, going back to what I said, anywhere that a patient is in pain, is in need of advice, and may have a difficult time getting to a dentist, certainly during the pandemic when the dental offices were closed and patients not wanting to go to the emergency room, really proved to be a valuable service. So here's a chart that showed what happened with telemedicine during the pandemic. And literally as the pandemic hit, the number of consults or the use of telehealth significantly shot up. Certainly was helped when you had our nation's leaders talking about telehealth during the early days of the pandemic, increasing awareness. So there was a significant jump up. After a couple of months, it came down a bit and continues, significantly greater than it was before the pandemic. Not quite at the peak, but this will continue going forward as a accepted method of providing healthcare. And it's been very interesting for us to see that the track of teledentistry really followed very closely what the track was of the overall telehealth use. A significant increase, certainly a decrease, below the peak, but a strong continuation of what is a new service offering, and we expect that to continue going forward. It's been interesting to really look at, what were the reasons for calling, and many times the patient was saying, hey, doc, I've got a toothache, or it was a broken tooth, or it was bleeding gums, or it was parents with teething children, or seniors with problems with their dentures. And again, many of these situations were able to be resolved with a conversation. And the disposition, again, we were able to prescribe over-the-counter medication or recommend an over-the-counter medication. In a small number of cases, really worked with the patients to say, you really are experiencing emergency, you need to get to an emergency room, or in many cases, helping the patient getting scheduled for a for a visit the next day. It's been interesting to track the age distribution of our patients. This has proven to be especially popular with the millennial population, but we've seen patients as young as parents with 2-year-olds, and we've seen, I believe, our oldest patient has been 93-year-old. So again, it's across all age groups, but millennials who are extremely comfortable using their cell phones for just about everything. the service is available through cell phones, through tablets, through desktop computers, and it really has been the millennials that have been pushing the envelope. I'm very proud of the fact, every patient is given the opportunity to rate their service, at the end of the session. About half of the patients take advantage of that, and we continue to run, about a 4.9 rating on a 5.5 scale. And that's largely because we're providing a service at the at the time when it's really needed, and have proven that we're able to provide some fairly significant relief. There has been some change in calls since the beginning of the pandemic. And one of the biggest changes, when we, back in March of 2020, very few patients had had any experience with telehealth of any kind. Now, when we're seeing a patient, more than 50% of the patients we see have had a prior telehealth experience. So that's taken one of the barriers off of the table. And once people have had a positive telehealth experience, it really hasn't been so foreign to them in terms of, continuing, the idea that, hey, I can see my dentist remotely. Hey doc, all I've got is a toothache. Help me decide if I need to, to come into the office. So on a percentage basis, there have been fewer emergencies and more really requesting information. Certainly, looking for information about COVID. Is it safe to go to the dentist, or I don't want to go to the dentist? What can I do until I'm comfortable going to the dentist? And we continue to find lots of patients really looking for help finding a dentist, and that's because some dental offices have closed, some have expanded the amount of time it takes to get an appointment, and that's again been a valuable service that the teledentists have provided. Again, COVID changed all the rules with telehealth and teledentistry, especially with the large increase in visits. You are now able to prescribe a controlled substance using telemedicine, but the teledentists have not gone there. I mentioned very briefly about the need for having to have a dental license in the state where the patient presents. If a patient is coming, again, that rule has been relaxed through COVID, but the teledentists are still sticking to that rule. So if you're presenting as a patient anywhere in the state of Arizona, you're going to be speaking with a dentist that's licensed in the state of Arizona. The HIPAA requirements have been relaxed in terms of the platforms. Doctors are seeing patients using Zoom or FaceTime or other video conferencing systems, but the teledentist has been very comfortable using a HIPAA compliant platform and expects over time that that will continue to be important in terms of having a HIPAA compliant service and being able to follow those rules in terms of privacy and security, both in terms of protection of the patient as well as for the doctors. At the very beginning of the pandemic, teledentistry reimbursement codes became available, and that certainly was a big boost in terms of the ability to provide teledentistry. In terms of just the impact on teledentistry, many patients have delayed or postponed routine dental care. And 1 in 3 parents have said that getting dental care for their children has been difficult during COVID. Dental offices are feeling extra strain in terms of retaining patient, attracting new ones, and having challenges in terms of staffing. And these are all situations that can be assisted with the use of teledentistry. So we look at why teledentistry is going to help oral health. Again, it has been a help in terms of weathering the crisis. It certainly can help to reduce costs. And if we can keep a patient out of the emergency room or out of an urgent care center and have them seen by a remote dentist, significant lower costs to the insurance companies, which really was a lot of the enthusiasm that they had, certainly wanting to be able to provide this benefit to their patients. But again, when a patient goes to a teledentist rather than the emergency room, significantly lower cost for the insurance company. It expands the access to care, and it's being embraced by patients. In many cases now, we're seeing that when patients are looking for a new dentist, one of the things they're asking is, is there a teledentistry option available? And I think that's going to be the case for lots of telehealth, and including teledentistry, that again, once that positive first experience has happened, we're going to look for that going forward. So let's talk about some new frontiers. And again, this is true for both telemedicine and for telehealth. The ability to get access to specialty care, and the ability for that initial physician to bring a specialist either as part of a referral or bringing them into the conversation. Probably the most important new frontier for telemedicine is the ability to include remote patient monitoring. So telemedicine, telehealth is no longer just a face-to-face conversation between a provider and a patient, but the ability to get that patient access to equipment so they can be monitoring themselves. And it could be things like temperature, blood pressure, pulse, or more specialized equipment, and having that equipment available, the results of that encounter available to the physician as part of that encounter. And I'll talk in a few minutes about how that's also happening in teledentistry. Another I'll call it a phenomena, but kind of a fact of life for telemedicine. Telemedicine has crossed over the line in terms of e-commerce. There are things that you can now purchase in both telemedicine and teledentistry. On telemedicine, for example, one can get contact lenses, one can get birth control, one can get hair replacement. These are often things that are necessary in terms of having a prescription, so that prescription can be written remotely, and the patient is able to get access to these products and services. And there are several companies that have sprung up specifically to provide products like this. Similarly, in teledentistry, we've worked with patients that have a condition of dry mouth and are able to write a prescription and get them access to a pharmaceutical product. Solutions for patients with TMJ and patients with sleep apnea. And probably the most significant e-commerce solution in teledentistry is the ability for patients to get aligners And this can all be done through the use of teledentistry. And going forward, all of this information, all of this data being extremely valuable and is going to be used by accountable care organizations and larger healthcare organizations as they develop solutions for population health. New frontiers for teledentistry, more integration with both the medical visit or the hospital visit, where it's going to be easy to include oral health as part of the exam. We're really hoping that there will be Medicare reimbursement for dentistry, which is going to expand, expand access and insurance reimbursement. There will be additional incorporation of artificial intelligence. We're seeing that already. That may be somewhat invisible to the patient and operate behind the scenes, but it's a tremendous tool. Again, this is not replacing dentistry or teledentistry. It's an additional tool for the teledentist to be used in terms of diagnosis and quality assurance and really helping the patient. And the other frontier I want to talk about is the frontier of Texas. Throughout the pandemic, we were allowed to provide teledentistry in 49 states. And it was literally on September 1st that the Texas Dental Board approved the use of teledentistry, becoming the, now ability to provide this service on a nationwide basis. A couple of new frontiers this year. I briefly spoke about remote patient monitoring. So take a look at this picture. This is what I like to call an illuminated tongue depressor connected to an iPhone, able to take wonderful pictures of the inside of the mouth. And those pictures can be transmitted to the teledentist to assist in their diagnosis. And this solution is being used in those emergency rooms and urgent care centers in Michigan. And we see this as another important tool assisting the dentist in terms of their being able to help the patient. And another service that literally launched on the 1st of September is a virtual tooth fairy. And here we have a hygienist able to speak to a child, maybe a child that has just lost a tooth, and able to talk them through the process, able to provide some oral health education, and just adding to the service offering that's available through the teledentist. Again, this is a service provided by hygienists, to our next generation of patients. So with that, I want to say thank you. You have some contact information here, but I think what I want to do is end the slideshow and be happy to take any questions that anybody has.
There's a question. What is triage to dentists? I think you might have answered some of it, but if you can talk through that process.
Yeah, so first, thanks for the question, and thank you, Jeanette. The process is having a patient speak to one of the dentists. If the dentist will then determine that that patient actually needs to see a local dentist, we bring on one of our customer service reps who'll work with that patient and then determine where there is a local dentist based on the patient's zip code, based on their insurance, Also, in some cases, the ability to pay, there may be some lower cost options available. And that customer service rep has access to several national databases of dentists, and we can, get that patient scheduled. So that's really how the process works.
Okay, and we have another question. What are the concerns for mental health when it comes to teledentistry?
It's a good question. Certainly during the pandemic, there have been, larger concerns for mental health, and our dentists really found themselves answering all different types of questions, not just about oral health, but once you have the dentist on the line, sometimes we were, hearing the patient's life story. So, it really required some training on our part, and that, has been done regularly, and that continues to help our dentists anticipate the type of questions that they're going to receive, which again, may be nothing like the questions that they received in their dental offices. But just trying to be a never pretending to be a mental health professional, but using whatever expertise they have to either help the patient directly or to guide them to necessary resources if they were really in a panic situation.
Thank you. I think we have, how do you prepare a patient for teledentistry?
There's a couple of pieces like that. Again, like I said, if a patient has had a previous telehealth experience, they're pretty much prepared for teledentistry. And if the patient is able to connect with us through their cell phone or through their computer, they're pretty much prepared. You want the patient to be in a quiet place. You want them to have good lighting. You certainly, in some cases, the patient, really is in distress. So you're trying to calm them before the conversation, takes place. But, all of those are factors. There's also some information on our website that's available to the patient, which describes the process so they can understand what to expect before they, engage with the dentist.
And what website is that?
Teledentist.com.
Okay. Let's see, we have time for a couple more questions. Why would someone want to be a teledentist?
Again, thanks for that question. So again, I started working with the teledentist. I also spent several years working with some very good radiologists who are teleradiologists. And we, question would be, why would somebody want to do teleradiology? One of the things that happened during the pandemic is that when a dentist's office closed, they were looking for ways, how do I continue to see my patients? This was a great way for that to happen. Another thing that we've seen is that we've worked with many dentists who are recently retired from their practice. And this has been a great way for them to still, practice their expertise, provide their expertise, but they may have closed their practice for several reasons. Possibly they've lost some of their manual dexterity and they didn't feel comfortable working inside a patient's mouth, but they haven't lost any of their mental acuity. So, what a great way to continue to practice. And we actually work with an association of retiring dentists, and we also work with an association of disabled dentists. And this has proven for us to be a great recruiting tool, but also really, a great opportunity for some of these dentists to ply their trade, especially during this time of need.
Okay, thank you, Howard. I think we have covered everything. Is there anything else that you would like to add?
Just again, a thank you, Jeanette, and to Health Choice for the opportunity. One of the biggest challenges the teledentist has going forward is just awareness, letting people know that we exist. So from our point of view, just spreading the word, letting people know, and hopefully, people can, if there are further questions, they can contact you or me, and be more than happy to continue the conversation.
Thank you, Howard. This was a great presentation, great increased awareness around teledentistry, which is, making inroads to overall health. So thank you so much. I think, let me see, there might be one more. Just to thank you for providing this service. So everyone, we're going to meet back again at 1 o'clock. We're taking a little bit of a lunch break, and we'll be back at 1 o'clock and learn more about how we in the state of Arizona handled social isolation and looking at specific populations that we address during this time. So thank you so much. Thank you, Howard. Thanks, everybody. Have a great lunch, and I'll see you at 1 o'clock.
Thank you.